Hello, everyone. This is Mayor Deirdre Waterman, and we're here for another Highlights of Pontiac. As you know, we are still in the state of emergency here in Pontiac, Michigan, for the COVID-19, otherwise known as a coronavirus emergency that is occurring as a pandemic. We're all concerned about the health and welfare of our residents and our citizens, and we want to give you constant updates, and we're so happy to have here today some medical professionals. And sitting to my right is Margaret Diamond, who is CEO of McClaren Oakland Hospital, also the Caramonas Cancer Institute, who has been one of our great partners in providing health care and quality services to the citizens of Pontiac and the greater Oakland County area for a number of years here.
Thank you.
We have worked with her and thanked her for all the support she has given us to bring healthy services, as well as sponsorship of so many programs that Pontiac residents have benefited from. So thank you for being here today. In addition, we wanted to supply you with accurate medical information. I know in these anxious times, we're getting information from all sources, and although we've attempted to keep you advised through these PSAs, through our website announcements, as well as through our Facebook postings, which we hope you are receiving, we wanted also to bring to you direct medical information that you know is accurate and dependable. So here I have also Dr. Tressa Gardner, who is Director of Emergency Services at McClaren Oakland Hospital, right here in downtown Pontiac. So I'd like first to talk to you, Ms. Diamond. Certainly you're no stranger to Pontiac City Hall. We have talked and you have been so supportive and cooperative in a number of the things we have wanted to do, both from the health side as well as from other city projects, and I thank you for that.
Thank you.
And to all of your staff who have been strong advocates of the progress of Pontiac. So tell us what's going on with the hospital right now, as you have been confronting and our first line defenders for the health concerns emanating from this crisis.
Thank you, Mayor. I think the first sentence I want to assure the residents of Pontiac that McClaren Oakland is ready for any type of intervention we need with the community. We have seen low numbers coming to the hospital, and I think Dr. Gardner will talk about why that is. We want any patients with symptoms to stay home and self-quarantine. Those who are presenting with symptoms are being swabbed. The county is involved in processing those swabs and identifying those who are positive. Thus far at McClaren Oakland, we have not had any positive cases. But we stand ready if we need to gear up our testing as well as hospitalize the patients. We have more than adequate amount of ventilators and the appropriate mask and gowns that we need to take care of the patients. The public will hear that all hospitals may be facing a shortage of gowns and masks because a majority of those supplies came from China. Our suppliers are looking elsewhere. Our governor is holding a conference this week with supply chain leaders of each hospital to assure that we can distribute supplies amongst hospitals in the state to increase the number of adequate supplies for our patients.
Now, when you say you haven't had any positive cases, is that cases that have been hospitalized or also people who have tested for being carriers of the virus?
So we've swabbed outpatients, we've swabbed ER patients, and we've swabbed inpatients, and as of today, none have come back positive.
All right. And how long does it take to get the testing and to get the results back?
Typically, I mean, the quickest you could get right now from the county is probably 24 hours, but I would say more 48 to 72 hours is the norm.
All right. So tell us what you're experiencing in the ER. Is it getting more intensive, or are the numbers dropping off?
So overall numbers in the emergency department, Mayor, have gone down because people are quarantining themselves at home, which is the right thing to do. The patients that we are seeing that are coming in, that we are testing, remember, we still are in the flu season. We are entering into our asthma and allergy season, so we have a lot of people that have respiratory complaints. We've done screening programs, so anybody that we've deemed this at risk, they are placed in a mask and put in a private room. to diminish the effects of having anybody expose other people.
You mentioned masks. Now, how does a mask affect containment of the disease? And we've been seeing pictures from other countries for weeks now of people walking about in masks. Who should wear a mask and who should be fearful?
So people that wear the mask, I can't speak to the other countries. I don't know what symptoms they were having. But why you would wear a mask in the general population in the facility at the hospital, you wear a mask to stop the spread of when you cough or when you sneeze or your what we call respiratory droplets.
Right.
That's how people get infected, because when you sneeze or cough, it goes everywhere. It goes in a dramatic pathway, as opposed to when you have a mask on, it's right in the mask.
Right.
So wearing a mask, if you're coughing or sneezing or feel ill, that's the appropriate time to wear a mask, so you diminish your effect to other people.
All right. So you are taking a proactive measurement to protect other people if you feel that you have symptoms that might be contagious.
That is correct.
All right. So that answers that question. So when people come into the emergency room, well, before then, if they have a symptom, what should they do? Tell us what the process is that you're recommending right now.
So if you have a symptom, a fever, a cough, or anything that you're concerned about, if you're well enough to stay home, stay home. Make your call to your physician, your private physician. And we also at McClaren have a telemedicine program that we'll give the number to at the end. Call and keep social distance. If you're well enough to stay home, watch TV, drink fluids, take Motrin and Tylenol. If at any point you become, sicker, some things to watch for as your fever is not responding to Motrin or Tylenol, you get short of breath. The biggest symptoms have been people have gotten short of breath, more and more short of breath. And that's the key when you need to come in to the hospital.
All right. So if you have a cold, for example, and I think everybody's telling people, if you have any cold symptoms, stay at home anyway.
Correct.
You don't want that brought to the workplace or to the other places where you might congregate. So if you have a cold and it goes away in 3 or 4 days, like a normal cold does, do you have to then worry about get other testing, or do you just assume that it's just a normal cold that you don't have to go in for testing?
That's a very good question. You'd have to assume that it's a normal cold, because
All right.
currently right now we don't really have set up testing centers.
Okay.
And that's where you would qualify for. So if you came to the hospital, we would not test you.
Okay.
The doc's offices and the urgent cares, we don't have enough supplies, we don't have enough testing. We're still going through the state. Now, hopefully this will change in this week, because the announcement today from the government, actually on Friday, was that there were going to be 2,000 labs coming online.
Yes.
That are going to be testing outside labs of the facility, different facilities. So then perhaps we can have testing centers.
Okay.
But the ideal is, to contain yourself, to quarantine yourself, and just assume that you have COVID-19. To have a definitive test we don't have a treatment arm for it. It's really supportive care, the things that we talked about: good rest, good hydration, fluids, water, and making sure you're eating appropriately and isolating yourself away from others so you don't contaminate them.
Okay. Does everyone with the fever and those symptoms mean that they have a disease? The COVID-19 disease?
No, there are many other things. We are still in the midst of the flu season, so we are seeing influenza A and influenza B. There's also many different things: sinus infection, bronchitis. Different types of viral infections can cause the same symptomatology. That's why this disease has been a little bit problematic for us, because it looks like everything else.
Yes, yes. And if you had your flu shot and still have symptoms of the flu, does that mean that you're more likely to have the COVID-19 because you've had the flu shot?
No, what we would recommend, so if you come into the ER and you have a temperature and you have a cough, we swab you for the flu.
Okay.
And we swab you, certain people, the older and the younger, we swab for something called RSV.
Yes.
To make sure you don't have, and then there's a respiratory panel, or viral panel that you can order as well, to ensure you don't have another disease etiology besides the COVID. And then if all those are negative, we'll swab you for COVID.
All right. So you were saying that there may be a lot of contagiousness in the population already, and there may be people who have been exposed and don't know they've been exposed and just don't have the symptoms and would never know that they
Correct.
had the infestation at all, is that correct?
That is correct.
So, at what point should people have testing, and who is getting testing at this point?
So currently, right now, we don't have enough tests. So only the
Yes.
tests are limited to only the patients that are coming inpatient to the hospital,
Mhm.
or healthcare workers that potentially have been exposed, because we have to go back to work.
Yes.
So we have to make sure that that if we are symptomatic, we get screened, because if it is COVID, there's a whole process that we follow in order to return to work.
Very good. I understand you were mentioning the fact that there are more tests now. The federal government has taken the initiative to make testing more available. I think Roche Laboratories is now
Right.
able to process.
Private labs are jumping in.
private labs
to-
are
Quest
getting
has them
in,
as well, so.
Yeah, so we want to catch up with what they're doing in other countries in order to be doing testing. Would you ever advise preventative testing if we had that testing capability available, and what would that look like?
Probably, I mean, we'll probably do some screening, just a
Screening
testing
testing,
center.
okay.
If if your symptoms or you've been exposed,
Right.
but you're well enough to go at home.
Okay.
Once again, that puts people at risk, right?
Yeah.
So if you can quarantine at home and recover at home and
Okay.
just assume that you have it, that would be the ideal. Until easy screening comes about and testing, a number of testing comes about.
So, in summary, your advice has not changed, I guess, from the first days we started giving people warnings and advice, and from the CDC and the Oakland County Health Society, all those warnings that we've been putting on our website and passing out for information to people, that if you have the symptoms of a cold, cough, and just shortness of breath, fever, first thing, call your health care professional.
Yes.
All right, and then ask the health care professional whether, by listening to your symptoms, they think you need further evaluation.
Correct.
All right, so that still stands for everybody here. So we've heard what to do if you're symptomatic. More importantly is what can you do to protect yourself, and what are the preventative precautionary measures that you recommend at this point?
Okay, yes, that's probably the most important thing we can do for ourselves is wash your hands, try not to touch your face, follow, even though it's very restrictive to us, not going out in large groups, not being in large settings, kind of almost the social distancing that we're practicing now, that is vital to suppress the spread of the disease. And
So Margaret, McClaren has a number of resources that are available to the public to help in this time, as well as just normally, your offerings for public health and safety. So would you like to tell the audience about that now?
Sure. I think, again, to mimic what Dr. Gardner talked about, the key is to realize signs and symptoms and discuss those signs and symptoms with your primary health care provider. If you don't have a health care provider, McClaren and other systems are offering telehealth options. For McClaren, if you Google McClaren Now telehealth, it will direct you to a website where you can just click online, and we've reduced our prices in half. I believe it's $29 now to go on and enter your information, and once you sign in, you'll be directed to a live chat with a provider.
That's a great resource for those of
Yeah.
us who either are between healthcare providers or maybe between visits, to know that you can always have that resource available. Thank you for providing that.
Well, I think especially in real time, because it'll decrease your anxiety if you're worried, or at least give you direction in terms of what the steps of self-quarantine, or as we say, the symptoms of the flu, the Motrins, the Tylenols, and the rest, and proper sleep and eating.
Okay. So thank you both for helping to answer some of the questions
Thank
that
you.
I'm hearing
Thank
and
you.
that the public is interested in. What I think you're hearing here, Pontiac, is that there are real steps you can take in this coronavirus emergency to protect yourself, and preventative steps that you can take and need to take, not only for yourself, but for those that you are around. We also are informing you that we have made all this information available to you through cable, but also through our city website that we're constantly updating, and the same information on our Facebook pages. So this is available to you, and it's also linked to the other healthcare agencies such as the Oakland County Health Department, as well as the CDC, the Federal Bureau, and the state government. And we thank our governor for her leadership in terms of declaring the state of emergency and making sure that we're trying to quell this epidemic here in the state of Michigan. And of course, I and my staff are always available to you. We're here to serve the public. And the number for City Hall, if you would like further information or guidance, is 248-758-3000. Have a great day. Bye-bye.